Okay, well, welcome everybody to the Teaching Value in Healthcare series, where we feature healthcare innovators from across the country and across the world that have real and novel insight into how we can both deliver and receive better care. We broadcast as a webinar and as a podcast on the third Thursday of every month, and we go out to medical students, to medical educators, to health system leaders, nurses, pharmacists, patients, everyone that has a stake in healthcare. I would remiss to not say that the series is supported by the ABIM Foundation and hosted by Costs of Care. So I'm hosting today. I'm Neel Shah, the Executive Director of Costs of Care, and I'm joined by David Vivero, who's the co-founder and CEO of Amino, which, as they describe it, is a company that for the last 5 years has been tapping into the digital paper trail of the American healthcare system to help people navigate healthcare decisions and costs. So David, thanks so much for being here.
Thanks for having me.
Now, this is a little bit different from a lot of the podcasts and webinars we've done so far because you're the first person that's really been in the startup space. And I think it'd be just really helpful for everybody just to hear a little bit about how you started your career thinking about transparency in other industries and then found an opportunity in healthcare.
Sure. And, my brother's a doctor, so that's about as close as I can get.
That's cred.
So he has a profile on Amino. I started Amino back in 2013 with some colleagues with whom I had started my previous company, which was in the real estate world. So I, learned about healthcare in the run-up to building Amino. And my experience was I had built a real estate marketplace, that was acquired by Zillow. And I ran our rentals division when I was there. So if you think about Zillow and other companies like it, things like TripAdvisor or TrueCar or Yelp or a number of other, leading internet brands, you've got a whole wealth of experiences that have been created for consumers that are grounded in transparency. This idea that, right in your pocket, you have this instant map of what's available to you, the quality of those things, the convenience and availability of those things, and all sorts of images and prices and so forth. And healthcare was not only without that, it was even worse. I mean, it was not just about transparency, but the experience was so difficult of even trying to get this information. And so when I left Zillow in 2013, I knew that I wanted to start another company, and healthcare hit me like a ton of bricks in that I had a pre-existing condition. I still have it, hereditary hemochromatosis. And that was enough in 2013 for me not to get a health insurance on the individual market because that was before the individual mandate was put in place. And so healthcare through Cobra was too expensive. I found a real narrow network plan that finally would take me. And so I had to find a new doctor. And so there was just this whole parade through and around the healthcare system very, very quickly. And that became my inspiration for starting Amino. And so Amino makes it easy for everyone to get the most out of their healthcare. What we've done is apply some of that playbook from some of my previous experiences to showcase the actual cost and quality and availability and safety and network affiliation of healthcare everywhere, from doctors to imaging centers to urgent care centers. And we try to make it easy for consumers to be able to make the right decision and avoid unnecessary bankruptcy, surprise bills, et cetera. So it's a resource that's made available for each of us to be able to find and book care online and know that we're arriving at high value care when we do so.
That's really helpful. I guess one of the things that I'm thinking about, and a lot of people that listen to this podcast or are watching over the webinar, part of the motivation is they're really interested in this idea of healthcare value, which for a purchaser, a payer, or a government means something on the macroeconomic level. For the individual patient, it's really about affordability and experience and the things that you were talking about. And I guess for all of those folks, I think for a lot of us, the idea that we should be able to see something about cost transparently has face validity, but then there's like the promise of transparency in healthcare and then the reality of it. And how have you thought about that?
Well, I mean, so on the one hand, what we invested in when we started Amino was actually gathering this sort of visibility. So we've got almost 10 billion health claims that power Amino, and it gives us insight into what health insurance companies actually pay doctors and hospitals and imaging centers. So, not this fluff that is unusable at the time that you get care, but the actual stuff that's going to hit your own balance sheet, your own stack of bills at the end of the month. And that was great. And it's an essential part of functioning marketplace in healthcare. But what was really different about healthcare, which really has informed our strategy, is that unlike buying a trip on TripAdvisor or thinking about your first home on Zillow or Trulia, healthcare is anything but fun or aspirational or joyful or anticipatory or anything that kind of gets you to be up all night looking at beach photos and hotel suites. And, if you can go back to thinking of one's own honeymoon, that's just a great way to spend one's time. And that's what creates the type of magnetism that those platforms have. And so in healthcare, there's this layer of trying to inform a consumer and to give them the information they need while recognizing where they're coming from, which is not wanting to engage with the issue in front of them in the first place. Like if they're injured or they're sick, the psychology of it isn't typically to, go and find out all of their options. A lot of times it's a lot of people trying to avoid these types of things because they're scary. And healthcare only makes it worse by making it more inconvenient. And so what we're trying to do, in some ways in partnership with Cost of Care, is to try and meet people where they are, in the doctor's office, in their pocket, with services that try to wrap this type of smart decision-making in tools that make healthcare not, inviting to just research for the fun of it, but actually integrate it into one's own workflows, which is something so much more important than buying, a trip or thinking about buying a car. And so that's one big component of it. The second thing is just going back to just the history of all this. I mean, healthcare ratings have existed for a long time. I was at a conference in December at the Healthcare Ratings Summit that Leapfrog put on, and there was a half dozen of us sitting on stage. And there was just this really telling question that got asked, which was, hey, what impact are you guys having? And it was, a difficult question for some to answer, because in reality, they're yearning for people to actually use this data instead of just a referral from the trusted physician or just a referral from their friend or family, or just the sort of top doctors list that they read in the back of an airline magazine. And so it's really, really hard to get people to understand that this data exists and that there are real impacts to doing that. And one of the things I mentioned on that stage is that I just think it's a really difficult climb to be able to assume that consumers will want to be enlightened about the differences in C-section rates and sepsis rates and readmission rates and those sorts of things. What we need to do is wrap these things in tools and services that make it so that they don't have to know these things in order to most likely land at the right provider. So things that we do are, things like badges and workflows and other stuff. So that's kind of an invitation into sort of how we think about the world. But I think fundamentally, that's one of the very different things that we bring to this market.
So I want to unpack that a little bit, because I think you alluded to different aspects of the problem that you're trying to tackle. I mean, one of them, I think often, the notion of transparency and consumerism, both of which are really attractive, get conflated together and, they're attractive for different reasons, but are not exactly the same thing. So one thing that you were able to do is power Amino, as you said, with lots and lots of claims and potentially get information that's more accurate than, and therefore more usable in theory. But then there's a consumerism challenge, is like we don't shop for echocardiograms and stuff. We interact with healthcare differently. And one of the things I'm particularly curious about from your experience thinking about other industries is why healthcare is different from, Travelocity kind of replaced travel agents, but Zillow did not replace real estate agents.
That's right.
And there seems to be like an agency problem in real estate and in healthcare that's paralleled.
You hit the nail on the head. There's two things that were really important about what you said. Number one is that transparency is an important component, but it alone does not define like a successful consumer market. So partially because of what I mentioned earlier, people they don't gravitate toward toward transparency alone. It's about packaging it in a way that also recognizes How do we put this type of information in the clinic? How do we put this type of information on the phone with a customer service rep at an insurance plan? How do we put this information inside of an on-site clinic at an office or in the HR benefit conversation? So there's a lot of ways that this has to permeate healthcare. But fundamentally, what is a problem is that there is known variation in what things cost, how necessary they are, how safe they are. And that exists in one literally world. And then in a parallel dimension is the world in which we're actually being directed for care. And our job at Amino is trying to kind of bring together and meet people where they are, no matter how they're being directed, so that the right answer is the one that they're likely to arrive at. You mentioned specifically as it relates to, Travelocity and, just the agency problems of healthcare. That's fundamentally true. One of the things that we have done this year is really partnered with employers to invite employers to sponsor really unique offerings inside of Amino. Because while we have a free resource out on the web that educates people on experience and where people operate and what their C-section rates are, a lot of healthcare is much more personal than buying an airline ticket. So imagine if you only had a network that would allow you to visit certain countries, and your rate of payment totally depended on the way that your passport was credentialed. That's kind of how healthcare is. It's no one's lens to healthcare is the same, and which means it's very difficult to disrupt, if you will, an entire set of intermediaries as something like Expedia or Travelocity did for travel agents. Instead, what we're trying to do is actually understand what is it about healthcare's lenses that we can incorporate into Amino's product, so that when you use it, we know in context what it's going to cost you because of your deductible, your utilization, your network, your health status, those sorts of things. And it's a totally different problem than just trying to eliminate all essentially the rent seeking that existed in travel, where it was just like an unnecessary intermediary. Like the whole system, layer by layer, is built into these individual lenses. And what we're trying to do is kind of cut through them so that you can see all the way through to your own out-of-pocket long-term experience what the effect of your decision is going to be. And through work that we're doing with you all and how we're trying to distribute this type of information, try to do it in the context that matters. So
that's really helpful. I feel like there's some really cool diagram that maps out all of the different lenses and the ways in that probably exist somewhere. But one of the lenses in particular, which comes to the way that cost of care and Amino have worked together, is the lens of the provider and patient, really at the front line. And you sort of mentioned that when we're thinking about making healthcare decisions, there's a bunch of different places where we dock in. So the one is in thinking about the particular plan that you might want, or the benefits package. Another, which people can do when they go to your website, is figure out, okay, I've got a certain plan. Now where do I want to go to receive care? And then the part that I think we're trying to think through right now is, once you decide where to receive care, then there's a bunch of decisions that get made about the specifics of your care plan that generate cost on the bill and all of that too. So how have you guys thought about, that seems to be the trickiest layer to penetrate, and have you thought about that?
It is hard. We've got nearly 2 million people that use our product every month trying to make healthcare decisions, and every single one of those people has a 1 in 2 million, healthcare need. They are pregnant with high-risk pregnancy in a rural environment with very little choice. Or they may be shopping around for a colonoscopy in the Bay Area and trying to avoid, a hospital-based colonoscopy or hospital-based imaging because of the sheer cost in that. And then they're on separate health plans. They've got all these different contexts. What we're really good at Amino is trying to give people access to a full map of what's available to them if they were to choose to get care. So if they were to choose to move forward, to know in advance what the impact is going to be on their wallet. What is difficult to understand, though, because we're just not diagnosticians, we're not actually trying to understand inside of Amino whether that care is necessary, whether it's likely to be effective for you, and what other side effects could occur. And I'm talking not only about side effects from a physical perspective, but also side effects from a financial perspective. How does this change your, reliance on certain drugs and so forth? So we are just breaking in to this, but one of the nice things about just a consumer internet mentality is that, you really iterate. The idea is let's do something specific and do it really well and then move on. And so we first started, we didn't even have prices on Amino. We just focused in on, can we use claims data to profile the experience of doctors, so that if you were looking for a hematologist with hemochromatosis, you didn't see someone who only specialized in blood cancer. Or same thing, an orthopedic surgeon, someone, if you had to get something done for your wrist, you weren't dealing with someone who deals with knee arthritis issues.
Right. So that seems to be, if I can just,
that's where we started. Yeah.
Distill that. I mean, it sounds like, and that makes a tremendous amount of sense to me, that you could at least start by directing people to folks, to providers who not only necessarily have the lowest prices, but might be the best prepared to help you with whatever it is, right? Whether it's hemochromatosis or just thinking about cost and value, as we've partnered around.
Exactly right. In fact, that's what's telling about our strategy, was that first we started off bit by bit building out content, but also we started not with price actually, but started with how do we actually bridge the gap for a consumer between, this is what ails me, this is how I'm injured, this is how I'm sick, this is what I'm looking to get solved for myself, and then mapping them to the actual prescribing patterns experience of the healthcare world. Because a lot of consumers don't even know the notion of a hematologist and what that person tends to focus in on, let alone the fact that there are multiple species within that genus. And so our initial product just focused in on that. And
way
now
to bring
we're
us
at a
back to
point
high school biology, by the way.
You got it. We're now at this point where finally we can do, like, for our employer, our sponsors, what we do is we actually create these things called smart matches, where we're trying to balance the idea of network affiliation, how cost effective the facilities are, what the experience of the doctor is, how safe is the hospital where they operate, and we actually just create a composite badge so that you don't need to be an expert in any one of those things in order to choose the right one.
So let me just say one thing that might be clarifying to our audience, which is that if you haven't been on the Amino site yet, it's probably worth checking out. But essentially you can search for different types of providers. And then I think what David means by badges is there's various ways of basically certifying clinicians that have certain types of expertise or skills or experience sets or what have you. One of my final questions for you actually is why a clinician would want to be part of this. So a lot of our audience is are clinicians. A lot of our audience are people who think of themselves as innovators trying to improve care, but why would they want to be profiled on a site like Amino? What's in it for them?
Yeah. So there's probably two big reasons. And generally speaking, things work best when there's fewer of them and their highest impact. And in healthcare, it's pretty clear. Number one, I'm very much in agreement with you, Neel, that financial harm is harm itself, and that in the same way that you're wondering if there's some interesting interactions between the drug I'm about to prescribe and some existing drug, to ask the question, is there some interaction between the surgery or drug I'm about to prescribe and their bankruptcy status or their ability to afford their home or their car to get and comply with additional treatments? There's a bunch of things that are interacting here. So incorporating cost into a decision with one's own patients is just, in our view, leads to good care. And that's one thing that we think is super important. The second, which many clinicians may not know or think about in their day job, but are probably starting to think about when they look at their own health insurance, is that their costs are rising, their deductibles are increasing. The number one personal finance concern by Americans last year, according to Gallup, was healthcare. And so increasingly, this is being used as a difference maker in choosing someone's own care. Am I going to a high value place? Am I going to a doctor who's going to look out for me from a financial perspective? And am I getting the types of surgeries and care that I consider to be high value because I can't afford it all? And I'm going to be forced to make trade-offs because I just can't reach back into my retirement account, or I can't pull my kid out of school to do that. So incorporating costs into one's own decisions, we hope, is also going to be the difference between attracting more patients and building a better practice, as this becomes more and more a reason for people to choose their care. So those two reasons, I think, should be enough to get a doctor to take a look at this stuff pretty seriously.
That sounds pretty compelling to me anyway. I mean, I think that's the bad news, good news story here is that on one hand, healthcare is getting less and less affordable over time. But the good news story is that there could be a way out with the types of transparency that you're developing and with clinicians that are willing to engage in it. So, David, I'd just like to say thank you. All conversations with you are illuminating. And
Thank you.
we look forward to you completely disrupting and revolutionizing healthcare.
Doing what we can.